There can be no universal health coverage without the proper deployment of information and communication technology. The management of the National Health Insurance Scheme, NHIS, understands this as fact and has taken steps to ensure efficient ICT facilities to support its activities. How integral is ICT to the operations of the scheme? What difference has it made to the way things are done in the NHIS, and where are we on the E NHIS project? These and more in this episode of Easy Access to Healthcare for All. Good evening and welcome. I am Aisha Mohammed Ahmed, your anchor on the program.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlight of events around the NHIS. In the news, military authorities seek a revision of the NHIS Act to include treatment of its personnel wounded in the theatres of war. These and more stories coming shortly.
Military authorities have called for a review of the NHIS Act to cover the treatment of personnel wounded in theatres of war. This is contained in a statement issued at the end of a stakeholders' interaction with secondary healthcare providers which took place in Abuja recently. They also called for the coverage of high-tech diagnostic surgeries and cardiovascular cases not captured by NHIS. Speaking at the meeting, the Managing Director and Chief Executive Officer of the Defence Health Maintenance Limited, retired Rear Admiral A.B. Afolayan, calls for the setting up of functional NHIS committees in hospitals to avoid misappropriation of funds by health management organizations (HMOs). He said the utilization of capitation for purposes other than the healthcare of eligible enrollees amounts to misappropriation of the funds and should be resisted. Also speaking at the event, Chief of Medical Services, Nigerian Air Force Air Commodore Olabode Babalola, and that of the Navy, Commodore Ibrahim Nuruddin, said, "The military is going to make a presentation to the NHIS so that operational injuries that are not covered by the NHIS can be considered in the review of the Act." The Executive Secretary of NHIS, Professor Nasir Muhammad Sambu, received an award of excellence from the in-house National Youth Service Corps members during their primary assignment with the NHIS. The award was presented to him on Monday, the 20th of December in his office in Abuja. In attendance were management staff of the agency. Speaking at the event, the representative of the Corps members said, "The award is in recognition of his outstanding efforts to improve the scheme and ensure universal health coverage for all Nigerians, as well as the inclusion of NYSC Corps members into the scheme." In his words of appreciation after receiving the award, the Executive Secretary, Professor Nasir Sambu, said, "The award is not only for him, but also for the entire management and staff of the NHIS for their tireless efforts to ensure the success of the scheme."
Any personal honor advanced to the Executive Secretary is not for him alone, because there is no way one person can be able to transform an organization which has been adjudged to be a very crisis-laden organization. There must be participation of especially top management committee, who are usually sitting in this hall to deliberate on every decision that we take, debate and agree and disagree. At the end of the day, whatever it is agreed upon is what we are going to roll out and ensure it is implementation. So I want to believe that this award is not for MM Sambo alone, it's for the entire management.
He added that the scheme has done a lot and will continue to do more in supporting the core members.
The program is easy access to healthcare for all, bringing you news and issues around the National Health Insurance Scheme. Information communications technology is the way to go, especially in service delivery. A look at the banking sector and how it deploys ICT to serve customers anywhere can give you a clue as to how the provision of healthcare services can improve with the use of ICT, and that is where the NHIS is going as it pursues universal health coverage for Nigerians in the next 10 years. On our next segment, we'll let you know how the NHIS is deploying ICT to better serve Nigerians and improve the efficiency of its services. Keep watching.
Easy access to quality healthcare for all. NHIS.
Healthcare delivery relies on information. It also relies on the history of the patient to accurately provide solutions. This information can be better stored and accessed digitally. It therefore goes without saying that the business of the National Health Insurance Scheme, which is to give health coverage to Nigerians, cannot be effectively done without ICT.
Enthusiasts, so and embrace it and use it.
Dr. Mustapha Lekki, former NHIS Executive Secretary and an IT enthusiast, couldn't agree more.
You really can't do the business of NHIS without a strong ICT backbone. Everybody has to be key into it. All the operators, HMOs, just like the banks. You know, the banks today now, you can go to Zamfara, you can go to Auchi, and whereas your account is in Lagos, and then you withdraw your money instant, and there's no problem. That's what we need to do. We need to have a strong ICT backbone for the. Without it, it cannot work.
When the NHIS took off formally in 2005, it showed signs of an agency geared towards achieving its objectives using ICT effectively. But by the time the current Executive Secretary assumed office in 2019, the momentum had slowed down.
When I came back to the NHIS and I saw the level of ICT development, I almost cried, because as far back as 1999, people come to the National Health Insurance Scheme to see computers. People come to NHIS to see effort where ICT can be the in thing. But at the time I came, there was no automation of the business process. In this 21st century, many small agencies have come and they have gone very far in deploying ICT infrastructure. NHIS was far behind.
One of the mandates that the Sambo-led management received was to develop a 10-year strategic plan to reposition the NHIS and accelerate progress towards universal health coverage. The 10-year strategic plan rests on 5 pillars, one of which is integration of ICT. This pillar has a goal to promote ICT integration of NHIS processes to maximize efficiency and enable innovation to advance NHIS goals. Today, ICT is key to the operations of the NHIS, as most of its activities and processes are ICT-based.
We do a lot of data processing, both in our internal operations and also in delivering health insurance for the country. We are processing a lot of data, and you cannot process data, both the input data, output data, analytics, and all that for business decision support without the use of ICT. So health insurance cannot be properly deployed or implemented in any country without ICT.
Prince Nasiru Ikaro sheds more light on what ICT does in the overall scheme of things, from registration to accessing healthcare under the NHIS.
No way we can even be talking about manual when we are talking about health insurance delivery. You can't talk about manual, because from enrollment of our various release into the system at point of registration, When they go to access care, there is verification that has to take place. You can't do that manually against a database of that enrollee information. When they now access care, how do you move that information, that encounter data? What were they treated for? What diagnosis? What drugs were they given? Okay, so how do you move that information at the point of care in a remote place like Calabar to a central point in Abuja headquarters? How do you do that? You can't do that manually. So you need ICT to port that data or aggregate that data to the center, and then you have to analyze that data in order to present some kind of disease map for the country, what has been treated where. And this kind of information help decision support for the country, for interventions, so that we can have a very viral healthcare delivery in the country.
Automating the operations of the NHIS has no doubt made access to social health insurance easier. The use of ICT saves the scheme a lot, and there is no comparison between the NHIS before and now, especially in the registration of new enrollees.
Manually, before you process an enrollment from Sokoto, you put them in shasha bags and bring them to headquarters. We process them into the system. It takes months before that information gets into our database, and then the enrollee can access care. But we have gone beyond that. Now we are now electronically enrolling our enrollees into the system.
The NHIS on its part has taken it further with the E NHIS project. What is E NHIS and how does it work?
The E NHIS is complete transformation, okay? Digital transformation of the entire health insurance ecosystem. Digital transformation. It talks about processes, it talks about the human beings or the staff or those who are even within the ecosystem, and also the technology itself, okay? So it's a complete transformation from what we used to do manually before into an electronic state. So that transformation itself is revolutionary. So what does that mean? It means that everything we do in health insurance is automated. From our internal operations, like I mentioned. Before now, our state offices, they'll be doing their vouchers and do all that and manually carry them, bring them to Abuja, it takes weeks. But now with the ERP, enterprise resource planning that we have deployed, it's click of a button. There are various state offices, they now do their vouchers, they submit, and then we have email systems across board, we have intranet systems in place. So that, for example, our executive secretary can now make decisions, internal decisions, even when it's out of the country.
E NHIS transcends internal processes and involves everyone in the social insurance ecosystem.
In the health insurance space, you find out that we now are integrating our systems. NHIS environment, we're integrating with HMOs, we're integrating them with healthcare providers, and we're integrating them with even state health insurance agencies. Okay, we have we have connectivity at state insurance agencies, because we didn't want just tell them, hey, we want you to bring us data or information about what is happening with this state health insurance. But what we have done is to even bring that connectivity to them, and we're paying for that. Okay, for state to be able to connect to a central server and be porting both encounter data, both the payment that is going on in the system, so I can actually know even what is the real cost of healthcare delivery in the country.
The E NHIS is indeed revolutionary. Early in October 2021, the Minister of Health, Osagie Hanire, was at the NHIS Annex Office, where the physical infrastructure is set up. For the E NHIS project, the NHIS is in partnership with NIGCOMSAT for the deployment of the electronic solution. Speaking at the end of the tour, the minister expressed satisfaction with what was on ground, stating that it would help the drive towards universal health coverage.
Well, I'm impressed, but as they say, the taste of the pudding is in the eating. We are going to see how it functions when it is fully launched and when the job is done. But from what I see so far, I'm impressed. It will be a great leap forward in the management of health insurance in Nigeria. One of the problems we have now is health financing. And health financing is not just availability of funds and resources, but the management of funds. So the e-management of resources e-management of financial processes will help a lot towards universal health coverage.
This project is something that will bring about seamless automation of the business process of the National Health Insurance Scheme, a situation whereby a prospective enrollee will stay from the comfort of their houses and enroll into the National Health Insurance Scheme. So all the bottlenecks and barriers that are there in the process of getting to go and enroll will be eliminated. So people can seamlessly join the National Health Insurance Scheme, and that will enhance our drive toward attainment of universal health coverage.
This infrastructure that E NHIS has put up is not just a critical national asset, something that it goes beyond serving Nigerians. It's an infrastructure that can serve other West African countries.
NHIS has a mandate to provide universal health coverage for all Nigerians. And the solution we are developing is to enable them capture all Nigerians into their database to be able to have access to healthcare through their HMOs and healthcare providers, HCPs. So we have been able to develop about 11 modules of application for capturing of these vital health data. We have 79 points of contact in Nigeria, 2 per state and some 1 per zonal offices, making everything 79. So Nigerians can go to any of these 79 points to register instead of doing at 36 points before now.
The E NHIS holds many advantages for healthcare delivery in Nigeria, as the General Manager, ICT, explains.
With this automation that we have done, which we call the electronic NHIS, we've brought efficiency and effectiveness, and we make health insurance and that vision of having to actualize universal health coverage in Nigeria not just a possibility, but with record time. Now, calls people can now, we are deploying, what they call it, call center, where people can come in, they do their complaints and all that. We're also supporting what they call emergency medical treatment gateway that is being implemented by the Federal Ministry of Health, but we'll be supporting them with our call center service, and also we are going to be the ones running the payments for access of care of Nigerians. What does that mean? It means that we'll have hospitals along national corridors. Lagos to Maiduguri, Sokoto to Port Harcourt, all these corridors along the road, we will have facilities that are accredited to provide emergency care.
The good thing about the entire automation process is that it is being programmed and managed by Nigerians, making sustainability and maintenance easily within reach. Riding on this platform, the NHIS assures Nigerians that apart from health insurance services and actualizing universal health coverage, they can get access to healthcare anywhere and everywhere.
NHIS will be the major source for health data because, one, we are creating a national electronic medical record for Nigerians so that anywhere you go, your health record will follow you. Okay. Also, we are providing health information exchange for the country. We've built the infrastructure, we have put it in place, and so we will become the major source of health indices in the country, major source of information for health interventions in the country, and NHIS will be that major agency of government that will help Nigerians, or at least help the government, to keep their promise to the people of not just good and quality healthcare services, but that when Nigerians need healthcare services, they can go to the hospital and get it.
You're still watching Easy Access to Healthcare for all Nigerians. And in this segment, we'll look at stakeholders in the scheme and how they have been partnering with the NHIS to give Nigerians easy access to healthcare. Hospitals are critical stakeholders under the NHIS because that is where the enrollee eventually ends up to access care. UCH Dansoho General Hospital in the heart of Kaduna is an accredited healthcare provider in Kaduna State, rendering primary and secondary care to NHIS patients. There is a designated section that attends to NHIS enrollees towards ensuring that they get required care. Mrs. Esther Francis is a desk officer at the NHIS section, and she speaks on what services the NHIS unit offers enrollees.
Used to try to say that whatever the patient needs or whatever services the patient needs in a hospital will render it to the patients, and whereby a patient doesn't know where to go to or what to do in the hospital, we normally direct or send a staff to take a patient to a place whereby he doesn't know in the hospital in order to be attended to.
Esther Francis says they receive new enrollees all the time, which they add to their database. She explains, however, that registration is usually done at the NHIS state office before the enrollee can be added to their register. Some enrollees, however, jump the process and cause a hitch in the implementation.
Sometimes the enrollee will not go to the NHIS office to register, especially when he has registered some of the members of his family. Then for the others that will come later, they will not go to register them. They will just come to register the newborn babies here, and we'll tell them that they should go back and register the patients there before coming to the hospital here.
The challenges facing the scheme are, however, not enough to negate the benefit of easy access to healthcare, as the NHIS desk officer calls on those not registered with NHIS to do so.
I'll advise them to try to see that they register with NHIS. They should try to go and register with NHIS because it's helping a lot. Even with your little money, you can come to get treatment and you'll be comfortable. I'm advising those that have not enrolled themselves in NHIS to go ahead to enroll themselves in order to benefit from the scheme.
As I mentioned earlier, Esther Francis is the desk officer at the NHIS unit at the UCH Dansoho Hospital, an accredited health provider working with the NHIS to provide healthcare for enrollees. Coming up next is your questions answered. Do stay tuned.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: how do enrollees access specialist care?
For specialist care, the enrollee will first attend at their primary provider, which in NHIS parlance we call the gatekeeper. So you go to your doctor where you have registered, and then the doctor, if sees anything necessary, will refer that enrollee for a secondary service. If the hospital offers that service, then there will be an internal referral. However, if the hospital does not offer that service, then it's referred to a center where that service is offered, and the hospital, therefore, in both cases, the hospital will actually get in touch with the health maintenance organization, who will actually issue the referral code, and then the hospital gives the notification of the referral to the patient, who either goes to the internal place if the hospital offers the service, or goes to the other service provider that actually offers that specialty service.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
This is where we draw the curtains on this episode of the program. If you have questions or comments, please send them through any of our contact mediums on your screen. You can also watch the program anytime, any day via our YouTube channel. Join me again, same time, same station for another episode as we continue to bring you more stories of happenings around the NHIS. See you next week.